Welcome back to my nursing classroom. In our previous meeting, we talked about medication, source of medication, and the route of drug administration. We were able to capture the enteral route and parenteral route as a type of route of drug administration. Today, we'll be considering the other route of drug administration. But before we go into that, we'll talk some more about intraosseous route of drug administration as a type of parenteral route of drug administration. So let's go into it. Intraosseous infusion is the process of injecting directly into the marrow of a bone to provide a non-collapsible entry point into the systemic venous system. So this technique is used to provide fluid and medication when intravenous access is not available or not feasible. So, as I said, intraosseous infusion is another type of parenteral route of drug administration, whereby the drug or infusion of fluids are being administered into the bone through the marrow, and this provides a non-collapsible entry point into the systemic venous system. And intraosseous medication or intraosseous administration of medication generally involve delivering through the medullary cavity of the long bone, and this does not provide only rapid systemic action of medication and fluid, but also it's more rapidly and easily achieved than other forms of central venous access. This route of drug administration is basically meant for is being opt when there is difficulty in getting access to the veins on the body. In the case of, let's say, burns and hypovolemic shock, in these situations doctors usually go for intraosseous infusion. So this not only provide rapid systemic action of medication or fluid, but it also more rapidly and easily achieved than other forms of central venous access. So this is a clear picture of how intraosseous infusion looks like. So the catheter is being inserted into the bone marrow. Then the fluids are being administered into the marrow. Mind you, we have veins and arteries, capillaries that are found within the marrow that will be able to take the fluid and the medication to the systemic circulation. So this is a clear picture of the intraosseous route of drug administration. Now, what are some of the indications for intraosseous infusion? One indication for intraosseous infusion or access is difficulty in establishing venous access, as in the following settings. So when there is difficulty in establishing venous access, then we opt for intraosseous infusion. One is burns, obesity, when the patient is very fat to the extent that the veins are not visible. You can opt for intraosseous infusion, or doctors usually opt for intraosseous infusion. We have edema, seizures sometimes leads to difficulty in getting access to veins. So because of that, doctors can opt for intraosseous infusion. And also, it usually happens when there is low levels of sodium and other electrolytes. So in case we want to boost these electrolytes in the system, then we go in for intraosseous infusion. Then when there is blood draw, in case we want to get a sample of your blood, we can use this route of drug administration to get a sample of your blood from the bone marrow. We have local anesthesia local anesthesia. In case there is going to be operation on a particular part of the body, then we can administer anesthetic into the bone that is particularly located at the site will be doing the doctors will be doing the surgery. For example, in case there is going to be amputation of the leg, then anesthetic can be administered into the bone into the bone of the leg, either the tibia or the ulna, in order to achieve anesthesia of the leg so that the leg can be amputated. Another is condition necessitating rapid high volume of fluid infusion, necessitating rapid high volume fluid infusion. In situations whereby we need to infuse a patient with high volume of fluid, we usually opt for intraosseous, since this administration of fluid is easily achieved using intraosseous infusion. Then we opt for, so one is hypovolemic shock as a result of low fluid in the system. We opt for intraosseous infusion route of drug administration. And when there is burns resulting in fluid loss, resulting in excess fluid loss, we opt for intraosseous route of drug administration. So basically, that's a little about intraosseous infusion. Now, advantages of parenteral routes and disadvantages of parenteral routes in general. One, it gives rapid action required. For the advantages, it gives rapid actions required in the sense that immediately the drug is being administered into the system, it reaches the systemic circulation, whereby the body uses it to for the purpose the drug is being administered. The second point is, or before I go to the second point, comparing the parenteral route with the anteral route. This when a drug is being administered using the parenteral route, it does not require or there's no need for you to pass through the stomach to the liver for desulcification and other processes going on in the liver, and there's not going to be any enzyme that is going to reduce the efficacy of the drug. So basically, it's very rapid. It gives rapid action required. Second point is drugs are not altered by intestinal secretion. As I said, it gives alternative to patients who cannot take oral drug. Patients who cannot take oral drug, as in the case of patients that has gone for tracheostomy because of the pain, or patients that has gone for surgery in the throat, maybe as a result of cancer or any other thing. This or any other surgery, these patients can opt for parenteral route of drug administration. It provides drugs that are unavailable in the oral form. Yeah, it's not all drugs that are available in oral form, so basically they are being administered using the parenteral route. Now let's consider the disadvantages of parenteral route. One is injection may introduce bacteria and other infection particles through contamination at the site of injection. So when a drug is being administered using the parenteral route, and let's say there was some kind of contamination at the site where the needle is being inserted, it can easily get into the systemic circulation, and the patient is going to have infections. Infections, or there's going to be inflammation at the site of injection. So that is a disadvantage of parenteral route of drug inflation. And the second one is it may also precipitate blood constituents and induce hemolysis. Yes, some drugs can precipitate the blood constituents and induce breakdown of the red blood cells, leading to anemia. And it's a big disadvantage of parenteral route. It causes irritation and pain. Depending on the type of drug that is being administered. It can cause irritation, and the insertion using the needle may also cause pain. So there's a clear picture of some of the drugs that are being administered through the parenteral route. So now let's look at some of the required equipment that we'll be using, requirements that we use basically in administering parenteral medication. One is needles. Now, what are some of the determinants of the needle, or what how do we make a choice for a specific needle in case you want to administer a drug? Now, the first thing you have to consider is the safety with which it can be used. The safety with which it can be used. Assuming you are going to administer insulin into the abdominal muscles, and you go and take a long needle, you may end up breaking some of the internal organs. So the safety with which the needle can be used is usually is one of the things that you have to think about before you make a choice. Now, the rate of flow of the drug to be given. Is the drug going to be given in a fast track manner or in a slow manner? If you want it to be slow, then you have to take a needle that may be narrow in terms of diameter, and in case you want to give it in a fast track manner, then you have to opt for the one that is large in diameter. The third one I would like to talk about is the comfort of the patient and the depth to which the needle is to penetrate. Yeah, as I said earlier on, the depth. In case you want to administer a drug into the skin as intradermal, you don't have to go for a needle that is very long. You have to choose the one that is very short in order not to injure the other tissues beneath the skin. Now, the length of the needle varies. We have 3/4-inch needle, and they are used for intradermal and subcutaneous injections. We have 11 by 2 inches needle, and they are used for intramuscular. They are long and they are used for intramuscular. We have intravenous and intrathecal, they are used for intramuscular, intravenous, and intrathecal injections. Now, this is a clear picture of the color coding of needles usually on the world. So basically, the greater the gauge of the needle, the smaller it is. The greater the gauge, the smaller it is. It starts from 25. With difference 2 up to 14. So the greater the gauge, the smaller the diameter. So we have red, orange, blue, purple, pink, green, gray, amber, and olive. Olive is the biggest one, and then the red is the tiniest one. So basically, this is the color coding of the needles we use on the world. Now, syringes. Syringe is an apparatus of metal, glass, or plastic material consisting of a nozzle a nozzle or needle, barrel, and plunger or rubber bulb used to inject a liquid into a cavity or under the skin. So they vary in size from 0.5 ml to 60 ml. In 60 ml, sometimes they are being called 60 cc or 10 cc, 5 cc. Basically, that's what we use. That's the name we use on our word. But it's varying in size from 0.5 ml to 60 ml. They are calibrated in cubic centimeter. That is the reason why we call it cc. So if 5 ml, then 5 cc. If 60 ml, then 50 cc. So they are calibrated in cubic centimeter and milliliters. Now, syringes for vaccines and skin tests are smaller and calibrated hundreds of milliliters, and have capacity of 0.5 ml to 1 ml. The syringes for vaccines are very small. You don't require a big syringe before you can administer a vaccine into the body. And they are calibrated in hundreds of milliliter and have a capacity of 0.5 ml to 1 ml. Syringes for insulin holds from 0.5 to 1 ml and are calibrated in units. So in case we ask you, or you are being asked to administer a drug or insulin to a patient, then think of how many units, not how many mils, how many units, because they are being calibrated in units. So go and give 5 units of insulin to a patient, 3 units of insulin to a patient. So syringes for insulin hold from 0.5 ml to 1 ml and are calibrated in units. So this is a clear picture of the label of a syringe. The label, we have the needle or the hub, the barrel, and the plunger. The needle, hub, barrel, and the plunger. So now let's talk about the other route of drug administration. The first one we'd like to talk about is inhalation. So inhalation routes, both oral and nasal, provide rapid delivery of drug across the large surface or area of the mucous membrane of the respiratory tract and the pulmonary epithelium. So inhalation routes, both oral and nasal, provide a large surface area for the drug that has been administered to diffuse into the systemic circulation. So it gives in terms of rapidity, it's equal to the other parenteral route of drug administration we have. So that is the inhalation for you. The next point I would like to talk about the inhalation is this route of administration is used for drugs that are gases. For example, some anesthetics. This route is particularly effective and convenient for patients with respiratory complaints, since it provides local effects. Then it's used for patients suffering from respiratory problems. Now, example of drugs administered via this route include the bronchodilators such as albuterol and corticosteroids such as fluticasone. So that is inhalation as other route of drug administration. So this is a clear picture of example of patients taking in his drug using the inhalational route. The next one is, or the second route that I would like to talk about, is the topical. Topical application is used when a local effect of drug is desired. For example, when you have rashes on your skin and you want to deal with it, then you apply a cream at the part that you are suffering from. Your basically it gives a local effect. A local effect. Example is cotrimazole is applied as a cream directly to the skin in the treatment of dermatophytosis. You have derma oil or ointments, you have antiseptic creams and lotions, and sunscreen lotions and powders. All of these are applied on the skin to provide local effects. This is a picture of someone taking a lotion to apply on his skin or a particular part of the body. The third point I would like to talk about has other route is transdermal, and it says that transdermal patch is a medicated adhesive patch that is placed on the skin to deliver specific dose of medication through the skin and into the bloodstream. So it's an adhesive patch. Adhesive patch, as you can see in the picture. Yeah, adhesive patch. So often this promotes healing to an injured area of the body. In case there has been a wound to a particular area, then we apply this kind of patch to the area for the wound to heal. So this another picture. Now we have installations as the last point, or the fourth point. Installations. There is the act of putting drug into body cavity. Example: the eye, the nose, ear, vagina, and rectum. This is the act of putting drug into the body cavity. Example is the eye, the nose, ear, vagina, and rectum. So, but the rectum is also useful if the drug induces vomiting when given orally. If the patient is already vomiting, or if the patient is unconscious. Note, the rectal route is commonly used to administer antiemetic agents. Yes. So these are the four main other routes of drug administration. The four main other routes of drug administration. We have inhalation, topical, transdermal, and installations. So thank you very much for your time. This brings us to the end of our presentation for the day. Bye bye.